Recording has started. I kind of missed the message that said recording has started. All right, everybody, good evening. Welcome to the Thursday, November 9th meeting of the Dunn County Health and Human Services Board. Thank you all for joining. Let us call the roll. Supervisor Steen, Supervisor Breslin, Supervisor Robinson, Ms. Rudy, Mr. Lamb. We are missing Dr. Hall, who is again at Gavin's state music concert, and Supervisor Hagan. But we do have a quorum. The first official item on our agenda is a public hearing for the Department of Human Services budget. We're holding this hearing to accept public comment on the 2024 proposed budget. Would you like to give us a bit of an overview of why we do this process and what it involves, and mention the fact that it has been officially noticed?
I will do that. Thank you.
Yeah, thank you.
According to the Department of Health Services and the Department of Children and Family Services for Wisconsin, our contracts with those two agencies mandate that we hold public hearings each year prior to the budget so that we have the opportunity to show the board show the community and be transparent with the community as to what the budget is, what we're proposing, our recommendations, and then to allow the public to make comments as to what services, programs, funding should be expended, and take that into consideration as a board with that. It has been posted by the Dunn County papers for 2 weeks, published for 2 weeks. That is the public hearing tonight at this time as part of this meeting. And if you would like, I could go through this summary page with you on the Human Services budget.
I think that would be perfect. Just on the summary page.
Yep, on the summary page. So I do have that up online for you. And so the summary page shows the business area of line 2 and 3, which is revenue and expenses that have to do with tax levy. And in there, it shows what we spent in 2023, or were allocated, I should say, not necessarily spent, but allocated and approved to spend in 2023, and the approved amount of revenue for 2023. And then there's a comparison to what is being recommended for 2024. And as you can see, the percentage of change that would happen, that's in column E. So when you look at this area, the revenue, we are requesting additional revenue in this budget for tax levy, and we anticipate spending a little bit less in this area. And the reason this is a little confusing, because when you look at our whole budget, we also have grants and other funding sources. And so these numbers don't match. And that's because of the grants and funding sources. And when we look at what it was in 2023, that's kind of how they do the budgeting and ask for additional tax levy then as part of that. And so, the next piece of this is line 6 and 7, looking at the revenue from grants, and that's less this year from 2023 or going into 2024. And then the expenses is also less. And if I can remind you, there's some things like the CBDG grant that expired and those kinds of things. So we then don't have the money and we don't have the expense as well. And when you look at this and kind of net all that together, which is what we need to do at the bottom line on the green box when it says net line, column D, says $836,671. That's what we're short, that we would be asking for additional tax levy than what was provided in the 2023 budget. And there's some reasons for that. There's probably a million little pots that I could take time spending, but the major pots that would be the difference in this is the increase in wages and salaries for people that would be getting any cost of living and step adjustments. And then we did ask for one full-time adult protection lead social work position that would be a full year position. And we did ask for a full-time clinical mental health therapist, but that would start July 1st through the end of the year, timing with that. So a half of year, but full-time position. So with that, the salaries, that's where you'll see that major jump in the request for $836,671 in tax levy for our department for 2024. Do you have any questions on that or anything else in the detailed area, which was sent out, and it's, that's made public as well, but it's pages and pages and pages of the detailed piece of it. So
it has been fully noticed. Do we have any public testimony on the hearing? No? And is there anyone online, Cassie? All right. Because no one is currently present to comment on this budget, I will adjourn the public hearing and we'll move on with our abbreviated agenda. Thank you, everybody.
thank you.
Always questions on the budget. If you have questions on the budget, Becky and Paula are certainly, or Jane are certainly available to answer them. All right. Next meeting date. Goodness, how does this happen? 12/28, December 28th. Yes.
I think
I did it. You're right. I did it again. I missed the minutes, and I have a comment on the minutes too. I don't know why I keep doing that. Check me. Yes, we need to approve the meeting minutes for the 26th of October. I would like to suggest one modification on 11B to note that, in fact, you've just plugged in the title of the agenda item, board approval or adoption of completed housing study. I would like the minutes to show that the board accepted the housing study by majority vote. Make that change. Any other modifications at this point? I need a motion.
Madam Chairman, I would move that we approve the amended minutes.
All right. Is there a second?
I will second.
Mr. Lamb seconds. Any further discussion, additions, corrections? If not, all in favor, say aye.
Aye. Aye.
Any opposed? Minutes for October 26th are approved. And now I move us to the next meeting date, which seems hard to believe that it's the end of December, December 28th. That would be a regular fourth Thursday. Any problems with that? We good? All right. We have no items that I have placed. We then are moving on to Veterans Service. Greg, we have a report, written report. Thank you.
Good evening, everyone. I'll start off tonight kind of in this abbreviated meeting with wishing everybody happy early Veterans Day.
Yes, and happy Veterans Day to you, Greg. Thank you.
It's celebrated officially on Saturday. However, I think we've got a lot of community events that are happening tomorrow. So I'd encourage everybody to at least take a little bit of a pause to kind of reflect upon and take an opportunity to thank those around them, as well as even if you're a dependent of a veteran, take a little bit of pause, because it takes the whole group to allow somebody that wears a uniform to be successful. So if you can't participate, take in a free cup of coffee or give somebody a pat on the back. The other thing that I'd like to kind of start this off before regarding local, Chair Morehouse had just signed a letter of appreciation. I'd like to read that, just make sure it's on record, to the local 434 pipe fitters, plumbers, steam fitters, and HVAC service techs for the work that they did in September. So I'll just read this here quick. Russell Boos is our contact with him. Dear Russell, I want to take this opportunity to express our appreciation and gratitude on behalf of the Dunn County Health and Human Services Board. We oversee the Dunn County Veteran Services Office, and it was reported at our monthly board meeting, the incredible volunteer work and coordination undertaken by the local 434 plumbers, steam fitters, HVAC service technicians on September 23rd, 2023. On behalf of the Health and Human Services Board, please accept our sincere thanks for conducting this great event. It is our understanding that you've offered this volunteer event for over 12 years and have assisted an estimated 150 Dunn County veterans. This is an incredible community program. We look forward to collaborating again in the future. Please extend our gratitude to those companies and employees who donated their time and resources to conduct furnace cleanings, inspections, filter replacement, and repairs. This partnership has made an incredible positive difference for our local veteran households. Again, we greatly appreciate your coordination of this incredible program. Thank you for keeping our local veterans safe and warm as we head into another winter heating season. Respectfully, Diane Morehouse, Dunn County Supervisor, District 21 Chair, Health and Human Services. And this
Very
is going
nice.
to, yeah, this is going to go to the chair of the County Board Supervisors, Kelly and Chris. Get that sent out. So get that on record to thank them for the good work. Thanks for signing it.
You're welcome. Thanks for writing it.
The next thing, kind of the report, attended with along with a lot of the other managers for Dunn County Supervisory Training at Chippewa Valley Tech. Very good training, covered, even though it's supervisory training, covered so many other things as far as some of the tough stuff I think that businesses, organizations are dealing with these days, with outside influences kind of coming in to, and it was a very good training. I think the my cohorts would probably agree with that. And again, there's a number of veterans events. We're going to attend at the Menominee Senior Center tomorrow at 11. Then also the Neighbors of Dunn County. We're going to be over there at 2:30 in the afternoon. That one we more will lead. We have 23 veterans that are there, and they do a great job at the Neighbors, recognizing veterans as well as their staff. So we're going to go over there and do a short little program to recognize them. We started our first planning meeting for an outreach event in the springtime. You know, the operational tempo is pretty high. However, sometimes what you need is not always what you want. It's probably the best way to say that, because what's needed is additional information and outreach to our veterans in the community to talk about benefits and processes. And we're gonna host that. However, it's we got a good planning committee, so hopefully they'll take some of that burden off of pulling all that together. It's been probably 2 to 3 years, but really pre-COVID, we did one every spring. And so we're going to have a 4 to 5 hour event that is going to have breakoff sessions and we've got some tentative ideas on health, VA healthcare to toxic exposure information, and we'll have plenty of vendors that'll be there for veterans to come, and it'll be on a Saturday, so we'll capture a lot of people so we don't take any food off their table to miss work. On the state side of things, I put nothing significant to report, but I will add to that. They're contacted as part of the leadership of our association. The Wisconsin Department of Veterans Affairs has their veteran management system, HMIS system, and they're undergoing an update to it. And they reached out to get and pilot it with some of the members, users of our organization for that. So that's again a good partnership, good credibility. They're reaching out to get input of the actual users of it. So we're gonna get some folks that are going to participate throughout the state. On the federal side, I participated. It was last Monday. Representative Van Orden, first Veterans Coalition board meeting, and that I think it lasted probably about an hour. I think there's going to be, I think they're intending on doing it every quarter, and so Representative Van Orden participated for a while, and then each congressional rep has specific veteran representatives that will chase down those specific areas. They're going to be more knowledgeable, and so had had those individuals that participated with it. And we correspond with all of our congressional representatives. I would say more, probably equally between Representative Van Orden as well as Senator Baldwin's office, a few times as Senator Johnson's office. But again, it's what the veteran wants. That's what we do. We provide them the information and the process. And a lot of times they just opt, I'm going to send it to everybody if they need help. But our role is to ensure that we try to deal with everything at the lowest level to not take up the time away from our lawmakers. And we will help the veterans put together timeline, efforts made to resolve things, and then that all goes forward. And usually things get resolved quickly if we have any issues. On the financial side, there was no financial report that was provided. Nothing significant to report on that as well. However, my math was wrong last month on calculating out the number of hours left for a part-time person. We actually, she didn't work as many hours as that I added up. So we've got more money remaining. And it was actually just how the report, I hadn't encountered this before, but if you're part-time, you get, it shows up on the report that there's like, it shows up as another 8 hours worked because you get special pay because you're not getting benefits. And so that's where I added up wrong. So it's more of a positive for the budget, but I figured I would confess my math issue, which came in handy because she's actually working an extra day this week to help out with the events that we have. I tell you, it's a nap thing. So yeah, so that's a positive, but I didn't want to come back next month and report and somebody that's writing down numbers like, I don't know what you said the last month.
We'll check you.
Yeah. Any questions about this? I would say an abbreviated narrative for the month.
Any questions for Greg? All right, go ahead.
I'll go into the Veterans Served report. I'll go right into the two impact statements. And the first one, it's always difficult for somebody to ask for a little bit of help when you're trying to maintain sobriety and you've tried every method you can on your own, and to be able to reach out and say, hey, can somebody help me out? And an individual, really seamless, probably the most seamless transition we've had to say, hey, I need help, into the St. Cloud VA. They have like a dual diagnosis treatment program to work both mental health as well as substance abuse, and things are going well, which is good, very good.
On that one, Greg, excuse me, I didn't, what, is there a particular program called Express Enrollment?
Not that I'm aware of.
Okay, that's the way it was framed in that impact statement, Express Enrollment.
Our phrase.
Okay, all right.
Yeah, our phrase.
I hadn't seen it before, so I
Yeah.
wanted some clarification.
I haven't experienced it, but it is a phrase that was used, so, because it went quick.
Okay, perfect.
The other one to highlight is conducted an appeal, and basically a young veteran, again, did not, and I might have spoke a little bit last month about it, just as kind of an addition, because I just got the report that it was approved. But sometimes we have to assist and identify continuity of symptoms, because typically, you're not feeling well for a long time before you go in, and then they tell you why you're not feeling well. And sometimes that's the path we help create. To identify and substantiate those symptoms that leads to the diagnosis and ties it back to service. And so this positive outcome for this young veteran, I think I described, because typically when it comes to obstructive sleep apnea, the go-to for the VA is that you're obese. And, and you have a 28, 29-year-old, 170-pound, 5'10" young man, and they have obstructive sleep apnea, there's probably some other reason. And it was easy to tie it back to his service that way. And so it's always good when we can eliminate out any of those other risk factors. And so things went well with that, and it was a good outcome for this veteran, and so that it again protects his family ongoing. Another impact, not particularly on this right here, but had been doing and I'll probably elaborate more on it next month. Been doing I think going back to 2013, an appeal for a veteran who gets leukemia, and it's a presumptive disease, and it escapes me. I didn't write everything down. He worked in Japan, and our rationale behind that is there's good research showing that there was the use of Agent Orange or herbicides in Okinawa, and actually the federal government's paid Japan money for toxic barrels dumped off the side, but they're not willing, the federal government, Department of Defense is not willing to go ahead and provide any toxic exposure, presumptive disease relief. So the troop worked in a yard that broke down all of the vehicles that were damaged from Vietnam. They would get shipped back, they'd tear them down, and then save the parts that they could. What has changed in military process and doctrine is that you wash every vehicle goes through a wash rack. So when you're leaving a combat zone, you wash everything in to get out all of the critters, all of the dust, all of the inhabitants that may come back to your region, so you're not infected. It's kind of like they want you to wash your boats if you're jumping around from lake. No different. They didn't do that back in 1970, and so with that rationale is that he touched, licked, tasted, inhaled toxins from working on those vehicles, because there's fragments, gun rounds to dust. And there is a study, I think it's a C-123 aircrafts that delivered Agent Orange, that is an approved study by the VA, that like the half-life of Agent Orange is 50, 60 years. And so they were able to prove that 50 years later in those aircraft that used and disseminated Agent Orange, it's still an active chemical. And so we use that logic. Anyway, long story short, just kept the appeal, kept the logic, and the VA just gave an approval. It's not, the notification letter is not done. They kind of agreed with us, but the veterans law judge, more experienced, actually I think went above and beyond to ensure that they helped this veteran out, because based upon the duties, it was easier for them to approve him based upon toxic chemical exposures with fuels. Fuels are JP5, JP8 inhalation that also causes those diseases. So they actually kind of took our logic and twisted it, because I think that could have created like a precedent setting if you start to get that, and they just say he was exposed to fuels on my end. Either way, it's good. So it's because he now has active cancer again, so it'll provide some protection for them. So those are some of the lengthy appeals and just encouraging families to hang in there, and we'll see it through. It's just a long process. So I'll kind of end with that long story.
It was a good story. Always really fine work, Greg, and I hope you understand how much we all appreciate it, and I'm sure the veterans in Dunn County and the region appreciate your work as well. So thank you. Yes, Supervisor Steen.
Yeah, if I might comment on this, I got a lot of friends that are veterans, they're my age, and a lot of the fellas and ladies came out, and things weren't recognized at that time when they got out of the service in the early 70s, late 60s. And so they may have applied or they may not have applied. And I would urge everybody here that you have a relative or a friend that's a veteran to come and inquire, because the government has expanded their parameters on what's accepted. And so what may have not been accepted before is now accepted. And I experienced 3 people recently that are quite thankful that they came down there. And like when I urged them, I said, I got no idea what you're eligible for, but go down there because Greg can maybe help you out. So.
Yeah, thank you,
Thanks.
Supervisor Steen. Any other questions or comments for Greg? All right, moving on. You do have a written staff report from Public Health. KT is obviously not with us tonight, so if you have any questions, you can raise them with KT, or you can certainly raise them here on the Public Health written report. All right, then we'll turn it over to Human Services. And Paula has promised to talk to us about the employee satisfaction survey and the stay interview results. And yes, I love to see that.
And I will jump to that in a moment, but I wanted to show you what was in the Dunn County news this week. Doug
Yeah.
Nell and the Family Treatment Court team had discussion, and Doug put this article together, and it was printed. So it was talking about our grant that we received. So I wanted to
Terrific.
show you that it's in there. So take a look at it if you get a chance. Now to the state interviews and staff satisfaction survey. Let's get that here for you. Now, where did it go? There we go. Okay. Start from the beginning. All right. So this is 2-part. The first is the staff satisfaction survey. And for those of you that may not be aware of this, there's been a long history in the department of doing a staff job satisfaction survey in the department, and really looking at that data each year and seeing where we're at, and then the department making decisions as to, if there's certain areas that we really want to focus on, and then, strategize how to do that and have the goals. And then the second part of the presentation will be the Family and Children's Service Unit stay interviews that I conducted with them as part of that, and I'll go into that in a moment. So the surveys we're going to compare 2023 to 2022. The surveys were completed in the department. We have almost 100 staff currently. Some of them are meal site staff and such, part-time, and we kind of add them together. And so they may not have received this because they don't have computers out there or whatever. But the majority of the staff that are full-time equivalency did receive them. The survey, and 77 surveys were completed in 2023 compared to 70 in 2022, and that was a 77% participation, which is actually lower than in 2022 just because our number of staff have increased. So,
But in the survey world, that is a very high response rate.
That is a very high response rate, so we're very happy about that. Yeah, so the questions, the job satisfaction survey consists of 36 questions, and the scores, there's scores on each of 9 subscales, and they range from 4 to 24, depending on how you rate them. And each item scored from 1 to 6 in those subscales. The higher the score, the higher the job satisfaction, and that scores on negatively worded items are reversed in scoring, just so you know, there's some of that. And then Cassie did a lot of work of doing that. So that's all I'm going to say on that. This is kind of tiny, but this is what the survey looks like. So questions like, I feel that I'm being paid a fair amount for the work I do. There's really too little chance for promotion on my job, those kinds of things. So just kind of get a feel of that, a couple pages of that here. And then the scoring. So possible score ranges from 36 to 216, depending on how you scored your sheet, your survey. And our mean score was 166 this year compared to last year at 155. So again, the higher the number, the better. So we increased by 11 points this year. But then when you go to the scores that have been normed by developer in these categories, in mental health area, our mean was 136. Our social service mean was 142, and the total United States mean is 148. So we're above the United States mean, which is good. So per the developer, the scores of 36 to 108 means dissatisfied. And we had 5 staff out of the almost 100 that marked that scored that. And in 2022, we had 1. So that's concerning there that we've got 4 additional there. Scores of 109 to 144 is called or titled ambivalent. In 2023, we have 24 staff, and in 2022, we had 17. And then scores of satisfied, which is 145 to 216. In 2023, we had 48 staff, and in 2022, we had 52. So a little bit of decrease there as well. So even though our mean went higher, we had some in categories there. So results by subcategory. So what I did here is list the subcategory, what that definition, kind of how they defined that, and then the scores for the last 3 years. So in salary, pay, we are at 16.41, and you can see that that's an increase from other years. Promotion opportunities, that has increased. Supervision, that's their immediate supervisor, that has increased their satisfaction with that. Benefits, that has increased by quite a bit there.
Oh, I'm sorry. That's great.
Contingent rewards, appreciation, recognition, and rewards for good work, that has increased. Operating conditions, policies and procedures and the like, that has increased. Coworkers, people you work with, 20.98, so that has increased. Nature of the work, the tasks themselves, that increased, and the communication has increased. So all of those areas we see an increase, even though we've got some individual scores lower, a few people that are lower. Overall, the numbers have increased. At least that's my interpretation of that. So questions on the stay interview? Yep. Or the satisfaction, job satisfaction.
Getting into the benefit column, as we've made some changes, I think, that have made it better. And next year, if you do this, it should be reflected even better because of the work that Jen and Human Services did about controlling the cost. And so that, and that's a big part of your job, your benefits and your wages, of course. But I mean, I'm happy to see that. And the county is trying to be better for our employees when we can.
Yeah, right. Human Resources has worked hard. I acknowledge that. That's been a great benefit to staff.
Yeah, and we have not been able in several years to raise salary in the way that I think employees would have appreciated. So I think even those scores that are kind of in the ambivalent category are okay. I mean, it doesn't send up a lot of red flags for me.
I don't really like the word ambivalent because it makes you feel like, I don't really care. But I think it's more of like, I'm satisfied, versus highly satisfied or dissatisfied. I would put it kind of in
probably
that.
more like it's okay.
Yeah, it's okay.
That's how I would frame it.
Yeah.
That word is
Okay.
problematic, but
Yeah.
mid-range ratings.
Yeah.
Well, that's great.
Any other?
No, and thanks for doing it.
Yeah, and Cassie did the majority of the work, so.
Well done, Cassie.
Yeah.
Thank you.
With that. So the Family and Children's Service Unit stay interview. So I've talked the last couple meetings about the state of the Family and Children's Service Unit and the many changes that have occurred in that unit, and that I spent time with each staff member individually to collect information in a stay interview. And so my purpose of doing that was just really to listen, ask some really strength-based questions to really kind of get to things, and I'll talk about that in a minute, and acknowledge people's importance and that we really want them to stay. And it was important for me to be able to say that as the director individually, that you are an important part of this team. I appreciate you and I thank you for your work. And so that was what I wanted each of them to hear directly from me as well. So I conducted these in September and October, and it was the majority of the unit. There was a couple staff that were out on medical. There was a couple staff that had just started a week or two before that. I did not conduct this with the managers. This was all frontline staff. Okay. So the interview questions, and I'm just giving you a sampling of some of, so that you get a feel of what they were. There was, several more than this, but, like, what do you look forward to when you come to work each day? What do you love to do that fills your bucket? What do you like most or least about working here? And if you could change something about your job, what would that be? What motivates or demotivates you? Do you feel physically or emotionally safe in your job? And if not, why? And what could be done to increase your safety? Remember that in this unit, we're working with a lot of people that are using illegal drugs and have some violence histories, all of those kinds of things. So, and we really want to make sure that people are feeling safe in what they're doing. And so that's where that comes from. What talents are not being used in your current role, and or what would you like to learn here, and what can we do with your talents in that, and then what can your manager, the county, or I do more or less of? So there was a few more like that, but that gives you a flavor of kind of the sampling of questions. So I want to first point out the strengths, because there was many of them that came from this group. And we just had a training from a trainer, a brilliant trainer by the name of Sarah Young, and she talked about bright spots, that we always need to look for the bright spots in not only our building, our coworkers and the work that we do. And so I titled this Bright Spots, because it is the bright spots of the interviews. And so this is just a sampling of it as well, because I could do pages on this, but I heard I enjoy and care about my colleagues. I love it when there's laughter in the office, and I love staff activities when we're working together to do team things. Really enjoy working with outside agencies such as schools, law enforcement, the service providers, those connections, working, on home visits, going out in the community, working with consumers, that relationship piece of the job. The support and flexibility provided by my managers is empowering and reassuring. And I heard flexibility a real lot of, we get our work done, but if we need to do something with our family and we have an appointment, they let me flex it so that I can work another time to make sure that I'm getting a real work-life balance. That's really happening here. Enjoy the variety. No 2 days are the same. I would say no 5 minutes is the same. Probably a lot like the school, right?
I bet.
Uh-huh. I continue to learn and grow, which I really, I'm really happy with that one, because we want to have that environment of that. I have passion and purpose for the work and serving my community. I heard a lot about that purpose. So even though the pay may not be where they wished it would be, that passion and service, and really enjoying that and bringing that every day to work. And I heard a lot about serving my community. I want to make this a good place for people to live and help the vulnerable people in our community. I feel like I'm an equal member of the team. And having a job where my personal life is recognized and valued makes a significant impact. So that's a sampling, but that's some of the, and I really tried to focus on themes. So I heard a lot of these, many times over. So they were kind of consistent themes. Any questions on the bright spots?
All good things that one reads about in terms of employee retention is the kind of flexibility that a job can provide, particularly when we can't offer extravagant salary and benefits. So nice.
Important. Yep, thank you. Challenges. And so what I did is break out challenges in 4 different areas, because I really think that when you're looking at a unit, it might be a symptom of something and there's other things going on, right? So it's been 30 some years that I've been in this field. And so I hear things over and over and over again in counties that sound just like, same, me too, all of those kinds of things. And so really in the field of child protection and youth justice, these are very common themes. The emotional drain and secondary trauma of tough cases, the weight of placement and permanency decisions. This is, examples like this is my 10th termination of parental rights case. I'm exhausted with, terminating rights. It's so hard emotionally to say you no longer are the parent of this child or those types of things, or placing children. And what do we do? That tough decision. You have a lot of power and authority of where do you place? Do you place with a relative? Do you not? Is it safe? All of those things. And then that secondary trauma that comes with all of that, what you see, what you hear. And I would add what you bring back into the office, because it's so heavy. You come back and share with your roommate or, your office mate, and you're re-traumatizing yourself and others as you're retelling those things. And so we really have to take a look at in the field of trauma, are we impacting it even more in ways we try to help or feel better, but really, is it really helping us? And so I just really think that's one that we need to pay a lot of attention to and figure out how to work with that. The physical and, whoops, I'm sorry now, look what I did. How do I get back? I'm going to take you back through it all.
That's okay.
Oh my, I shouldn't have clicked. One more.
One more.
Okay, from current slide. There you go. Physical, emotional safety implications. That's just really challenging in this field. Lack of social determinants of health services, supports, and education. So we are working with people that you're trying to help in recovery, and they don't know where they're going to sleep tonight, or where their kid's going to sleep, or what they're going to eat tomorrow, or, what do I do because I'm relapsing, and I really want math right now, and you know what I mean? And I don't know what to do with my kids, and there's all of these kinds of things going on. And so without a lot of community supports or things to help in that area, it's challenging enough to work with families, but then you don't have that support of where do you go? What do you do? Help families with that. And community education and supports, there's always that of just lock them up or, or take kids away, you should or you shouldn't, or those kinds of things. So there's all of those things that weigh on workers and what they do. Many times people come into this field because they've had experienced trauma in their own life and they want to help others. Right. So sometimes they don't even realize it until they're in the field and go, oh my gosh, what's going on with me? Right. And it might be a trigger of something that happened with them, even though their heart's and doing good, there's stuff. So we're constantly talking about what about you? How do you keep yourself safe? What is your history? All of those kinds of things. But we do have a higher number of people that are in the field that have actually experienced trauma themselves. And so that impacts, and how do we handle that? Challenges between protective authority, involuntary cases, and voluntary programs and services. So in child protection, youth justice, we have something called protective authority. So if they meet a standard of unsafe, we have the authority to take kids into custody, place them, do all kinds of stuff, which is really heavy. And we also work with service providers that do this voluntary. So we could have somebody that's using, we say, you can't use, we're going to drug test you, all of these things. And then we have them connected with the service, and the service says, you have to voluntarily do this. And if you don't want to do it, that's okay. You don't have to be part of this program. And child protection is going, no, you have to be in this program. And the voluntary program is going, no, they don't. It's voluntary. You know what I mean? So there's some of that. And I've heard this over and over again of we need them to be in this program, but they don't want to be, so there's a lot of those kinds of things going on. And there is some belief that in this field of child protection and youth justice, that the work's harder, there's more stress, there's longer hours, they're on call compared to all the other units. And so there's just some of that feel of that where, everyone's work is hard and it's just different, but sometimes they can get into that negative thinking of our workers harder or those kinds of things. Questions on these areas with the field of practice?
On that last item, I understand the higher stress, but do you think they actually work longer?
I do think that there is quite a bit. I mean, I'll give you an example. Polly and I were talking about this, this last week. They got a call. I don't remember what time they started this, but I think they got home at 2 a.m., 2 different workers that were doing it. And they were back in the office at 8 a.m. for a meeting, and they had to be in court and all that. And they worked till 7 o'clock that night. So they may be able to get time off the next week or the next week to make up for that. But it's the adrenaline, and so it's the exhaustion of some of that. The next week they may not have that, right? So I don't know. I can't tell you because a majority of the workers in the past have all been salary, so they never mark that down. So we have no history of that because I tried to get a real feel of that, but because they're salary, they're just working and taking off. So we try to encourage them to be off or do whatever we can, but I do think there's that heaviness of that. Good question.
Other questions?
I do. I'm wondering, realizing the gravity of what they're going into, are there systems in place to maybe screen some of your workers as they come back with trauma, make sure they're ready to go out, or places that they can be referred to right away for assistance?
So that's going into my recommendations, and so I'm glad you brought me there. And so I'm gonna, I jumped there. Yes, we can do better. We can do better with that, right? So right now, that's not happening. Okay. So the actual unit. So this kind of hones in the unit, and this is just kind of a sampling of themes that I had. The crisis work always takes precedence and everything else falls off the plate. And so you have good intentions to do training, you have good intentions to do celebrations and awards and recognition, you have good intentions to be innovative, you have good intentions to work with the worker that you scheduled the meeting with, but because this call just came in, you no longer can do that because you're running or the manager's running or that. So it's always the crisis cases that are running like the hamster wheel. And so, the other stuff falls off. And so when that continues to fall off and no one's lifting that stuff up, you begin to become unhealthy. And I see a lot of that in this unit, really. So what happens then is you get a lot of drama, negative attitudes, cliques, judgment of others, personal and professional, because they're exhausted, they're not getting the appreciation, they're not getting the supervision, all those things that they need. And so then it just becomes negative, and that's what we see in a lot of cases. And not every worker, not every situation, but you're seeing some of this happening. Managers have too much to do, which impacts, the training, transfer of learning, lack of inclusivity and diversity, including generational needs. I heard, like what I need is way different than what somebody that's 23 just getting out of school needs, right? And I mean, there's a lot of generational studies and research on how you, have to work hard to try to meet all those needs. But if you're running from crisis to crisis, you're not thinking about that. You're thinking about that crisis. Lack of presence in the office. Managers are trying desperately to catch up on paperwork because they know that workers can't do the next thing in our system until the last thing is approved, and they're sitting there waiting on them. So then it's like, we need to telework so that we can focus on this, and the workers are going, but I need you here. And so there's a lot of that going on. And so, we recognize that. Lack of validation, appreciation, and celebrations. And then manager, oops, I clicked, I'm a clicker. Manager health and burnout. And we're seeing some of that because of all of this going on. And so, I'm going to get to recommendations again, but any questions or thoughts on the actual unit in that category? Okay. As a department, when I heard things that I thought could be addressed as a department or might be more about the department. I kind of put them in this bucket, even though they kind of fit in the unit and this bucket. So this is where I place some of them. Lack of communication and collaboration between units. So that lack of cohesiveness, again, that protective authority versus voluntary cases and those kinds of things. Then it just kind of comes with some clashing and not understanding the roles or those kinds of things that come with those different types of cases. Judgments, perceptions, negative attitudes, and talk about other units personally and professionally. You can get some of that in between, and that just breeds negativity. Dress code, I heard about some of the dress code, personal, and I've talked to them about this, that personal accountability instead of management addressing, really talking to them, and I'm getting into recommendations, but I met with them and I said, what do you want to look like as a profession? You decide what's professional. You talk to one another because they're like, this person shouldn't wear this and this doesn't look good and this doesn't. Go to their manager and have the manager address that. I'm like, no, this is your team. What do you want to look like? So some of that, like you teach people how to address some of these things on their own and like develop their culture and their professionalism and those things. And please remember that, we do have a lot of young, new people that have never experienced this. They're coming out of college and COVID and right. So the dress, all of those kinds of things. And then telework expectations are not real clear for them. We're coming back into the office, but when can they, can't they, do they have to cover each other's work if they're, those kinds of things. So I put that in a department because I think that needs to be addressed as a department, not just in their unit. So I put that there. Any questions or concerns about the department challenges?
Questions for Paula?
Okay. County challenges. And here's where I need your help.
Yep.
Okay. So county vehicles are not available when needed. I have heard this all across the department wide that people are trying to go out. They're putting other people in their cars. They might be out to homes with bed bugs. They might be, headlights. They might be transporting children, I've had people throw up in my car. Those kinds of things, and you're in your personal vehicle when there is not here, but years ago when I was doing this work directly. If there could be any way to move to additional county vehicles, very challenging, to do that in your own personal vehicle. And plus they're paying in their personal vehicle when they're driving, they're paying that mileage up front, that payment for their own gas, all of that. You've got some young adults that are just out of school paying college tuition, rent, all those things, and just adding a lot of miles into their own vehicle that they're paying for the gas.
Do we have a county-wide policy on use of personal vehicles versus?
Well,
County
we use the
vehicles?
county vehicles when available, and then if not, they use their personal vehicle. And so what's happening is there just is not enough county vehicles. And I did talk to Scott and I did talk to Jenna about this issue because again, like I said, it's department-wide, not just this unit. And, Scott said they have received all of them that they've ordered, so there's nothing pending out there, but he would talk to the facilities committee on it. But I just don't know if there's something else that can be advocated on your end of that.
Madam Chair,
Yes, certainly, Supervisor Steen.
do we have credit cards that the employees can use?
For the county vehicles, there's
Okay.
credit card. We can either go to the highway shop and fill up, or if you're not by that, then you can go to the, for the county vehicles. But when you're driving your personal vehicle, you have to personally pay for it.
And so then they have to fill out a
To get reimbursed.
per diem.
Yeah, to get reimbursed.
And so then that's monthly, so there's a month behind.
But they submit it, and I think it's whenever, like they might submit it by month or every couple of weeks or
Yeah,
something like
what
that,
I'm-
and then get it, but
Yeah, so what
Yeah.
I'm saying is they gotta float the money for a month. Yeah.
yeah, and sometimes it's hundreds of dollars because
Sure.
of the
Yeah.
amount of miles that they're
Sure.
putting on transporting, for visitations and different things. So that's challenging when you're at that stage of life. On
I just-
personal, yeah.
Kind of a follow-up question with that. How does insurance work for them then? Is it their personal
Mhm.
or?
If you're driving your personal vehicle, then it is, you're in an accident, your personal insurance is, billed, you have to take your car in to get it fixed, you're out of a vehicle while it's getting fixed, all of those kinds of things. So, the opportunity to use a county vehicle's got so many different benefits to employees.
And I would just comment that I'd be worried about personal liability for staff members as well if there was
It
an
is.
accident.
It is. Yep, you do have that. Yeah, good point. No incentive to stay or take on extra work. And I know this is something I've been talking to Jenna about, of looking at, is there a way to incentivize things? You have people that take on huge projects, help other counties, help other situations. There's, vacancies and they take on extra cases, a lot of extra work, things that are just really above and beyond what one would expect. And there is no incentive to do anything like that. And so, a lot of people do it because it's the right thing to do and they want to be a good team player. But it is a lot of extra work. And especially like in this unit where we've had vacancy after vacancy after vacancy, now they're not only having double the caseload, they're also training new staff, training new staff, training new staff, exhausted, right? When obtaining additional education degrees, it's rarely tied to a different pay grade or incentive. And so there is no incentive to do that. There's a couple of them, like if you're a case manager and you get your certification or licensure, you do jump up a grade, but otherwise there's not. To get a master's degree, to do any other type of education, there is not any type of incentive. Or, some places we will help pay for a portion of the education, or we'll give you time to do this, or we'll do those things. So that is just something that they said would be nice to be able to have, or, some salary versus hourly status. And I know this is something that has been looked into. There's case law on it, that if you don't have your certification or license, you are hourly versus salary. But in this unit, what was happening is the hourly workers were put their 40 in. Let's say it was Friday at 10, they were out the door. All the salary staff were still there working because they had to get it done. So, I talked, when I get to recommendations, talked a lot about, what is the expectation here? And do we just pay overtime to allow people to help? And, we have to outline what those expectations are for people. And it's not just that you are out of here at 10, but we need to support that by saying, yes, we would pay the overtime or do whatever we need to do if there's a crisis going on. So just some of those kinds of conversations to lay out expectations. But there was a lot of conflict with that. And then there was so many changes that occurred in the last few years, and how that impacted the department with contracted versus Dunn County employment transitions. That was huge, and it continues to be huge. We tried, Jen and I spent a lot of time looking at what house call employees came in at. They were given a wage, comparable wage, and even an increase than what they had, but they were not looked at individually, as in you came in with 20 years or you came in with 1 year. So you kind of went to that grade and your vacation and all of that. So people just really were all over the board, and it really didn't give any credit to histories and, like how much work, past experience and those things. So you had people with lots of experience at the same rate as maybe somebody's been in the field a year or two. So there's some of that issue that was happening.
Well, let me just interrupt briefly. You may not know that the county had for a long time contracted services to an organization called House Calls. And they were essentially, they were all classified as independent contractors. And they were essentially doing exactly the same work as county staff. So a decision was made, working with Corporation Counsel, and the board to pull the house call workers back into employment because they were essentially doing exactly the same work as county employees. There's some worries about litigation and other kinds of things, but it was a fairly substantial change that was made in our staffing. Yeah, Supervisor Steen.
Yes, Madam Chairman, I probably can give a little more history on this. The move originally was made to save money for the county. The people were doing the work, they wanted to farm it out, of which I'm against doing that. Anyway, it's beside the point, they did it. Then all of a sudden, we weren't in compliance with the law. That's why they had to come back. We weren't in compliance with the law. So good intentions, but, and I'll just share you my philosophy on county employment. I would rather have the people employed by the county so you can manage them versus an outside contractor where you have no control because you have a contract and you have to negotiate with that management. We did the same thing with our janitorial service, and now we've brought a large part of that back. So that's more of a complete history, and nobody thought that we'd have to feather them back in. So that's where we're at.
It creates some conflict with the change and those
for
kinds
sure.
of things. So, and then wage study removed the senior social worker status. When the wage study was done, we did have a senior social work grade that was here before, and so social workers that were here for many years were able to be at that status. And so it was, you're able to put that on your name that you're a senior social worker, and so there's some status that comes with that as well as pay that came with being here for a long time. They've removed that, and so, that felt hard for people. Any questions on the county challenges? Okay.
Supervisor Steen?
I don't know. This is, I may be jumping the gun, but do you get to exit interviews in your presentation here?
I do not, because these were stay interviews intentionally with staff that we were trying to say, we want to retain you.
Yeah.
We do exit interviews.
Okay, my question then for the exit interviews, for these departments, who conducts the exit interviews?
The manager of the staff, and then if they would like to speak to HR, they can do that as well.
Okay.
I do want to say there was a couple staff that had been in this unit that had just recently transitioned into a different unit, and I did meet with them and ask them these questions as well, because I really wanted to get a feel of why that transpired and what their thoughts were. So it was kind of like exit interviews from the job, but they're still in the department.
Thank you.
Yeah. So when one thing I wanted to share here with you is our current organizational chart for that unit. And I didn't list all the staff's name on here, the frontline staff, but you can see, I supervise the two current managers of the unit, and then Manager Radcliffe has 7 staff and 5 programs underneath her, and then she also has 2 lead workers underneath her. So that's 9 staff she supervises and 5 different programs, which is extensive for this type of work. And then Manager Anderson has 9 staff and 6 programs underneath her. So when you look at the type of work that we're doing and these numbers, you can see why this other stuff is falling off, right? That I described and how to do that. And so I went to the Wisconsin Child Welfare Workload Study that occurred in 2021, and they spent hundreds of hours doing this survey or this research on this, and met with many, many counties to try to determine what is the right fit for how many cases a worker should have, all of those kinds of things. And then how many supervisors per staff and and they broke it down by hours because every county is different, every job is different, right? So then they broke it down by hours instead of actual number of staff because there's different types of staff. So what came out of the study is they said 1 supervisor in this type of work for every 555 child welfare professional hours per month. So when I did the math for our department, by the number of month and staff and all of that, right now we have 1 manager for 1,557 hours compared to what the state is saying based on the research and the work that needs to be done in cases for supervision. We do have 2 lead workers in the unit, and so that lead worker is supposed to be helping take some of the load off the managers, but we've never been able to move them off of full caseload. So they're doing a full case work, plus then trying to be support, training, teaching, helping the workers. And so even though that's some support, it's not a whole lot because of the amount of cases that they're trying to balance as well. So the next steps. We had a vacancy in the unit of a child welfare worker and worked to change that into a manager position. And when I worked with the managers and looking at the number of cases, we felt we could do that, although we're going to have to continue to monitor that to make sure that we didn't cut that too short. But we felt like that move would be appropriate. So that when we fill the position of an extra manager, that reduces the hours down to 1,038 hours per month per manager. It's still almost double the amount, but it's something, right? It's better than it was before at the 1,557. So we eliminated the case manager position, replaced with the manager, and our next step is to really redefine the lead worker's duties and roles and to reduce that caseload as well, so that we can also then provide additional support to all of these new workers that need training and support and all of those things. So as part of the remedy is to really increase that management ability. And so we received approval to do that because it was within the budget with just moving the dollars around that we had available to us. We advertised, we interviewed this week, and we're working on that. So hopefully that will happen shortly to have that position. Any questions with that piece of it?
Any questions or comments here?
I lost my org chart. It was here this morning. Oh, there it is.
There it is.
There it is. Oh,
Just
let's
click
have to
again.
click again. So what it would look like now is to have the 3, we'd have 6 staff and 2 programs underneath 1, and then we'd have 4 staff, 5 programs, and a lead worker. So you can see that breaks it down quite a bit more. So hopefully that can be helpful. All right, other recommendations and next steps. And because of time, I'm not going to get into complete details about this, but can kind of give you this overview. Training, I'm hearing, that was the biggest theme is we have all these new workers and there's not a good training plan or system. They're kind of just like meeting with other workers and that. There is a professional development system for child welfare. And so there are trainings that they have to participate that are mandatory, but then you have the county kind of training that supplements that. And because of the managers being so busy and the workers doing the extra cases and trying to train, the new staff are just kind of floundering. And so we need a good training plan, develop that and work towards that. That will be one of the things that we're going to, address. Culture development and expectations of the unit. So lots of those conversations, just like I talked about the dress code. How do we want to talk with each other? What is that expectation if somebody's doing that? How do we respond? How do we help lift each other up? Those kinds of things. Teleworking expectations, talked a little bit about that as a department. Working on interdepartment development and expectations and roles and all of that. I have some thoughts about how we can do some of that stuff and develop and implement a plan for safety. And so that's not only physical safety, but emotional safety. And I'll just give you an example of what they talked about is that they go out and they're so busy that nobody's even noticing, are they back? If they go out at night on something, who knows that they came back, all of those kinds of things. So they live by themselves. Nobody's going to know whether they came home or didn't come home, right? So some of those things that you're just like, because I think people are just busy and doing and doing and doing, but not really thinking about what is the impact and how do we provide safety. So really pulling together safety plan and how do we communicate and those kinds of things. Because we're working with tough people, So working on that. Developing a plan to support, celebrate, and recognize staff. And I think that can be a department-wide. We don't have to reinvent the wheel just in that unit. It can be department-wide, right? Healthy team development. I'll work with the managers in that on that. Support and accountability for staff who may be experiencing burnout. I know we give a lot of support as in, how can we help you? Here's EAP. We've not been doing like crisis interventions for afterwards and the teaming on that, which, you come back from a tough thing, you get a group of professional people with the staff and walk through that experience and help them with the trauma instead of relying on your roommate, right? And also, other types of supports there and accountability as well, because you could offer, but if staff don't take it, and then it's like, so what do we do about that, right? So working with that as well. I talk to facilities and HR regarding vehicles, but anything you can do to help support that, I would appreciate. Staff incentives, educational recognition, all of those kinds of things that we talked about in that area. Anything you can do to support any of that would be very helpful. And then keep the good stuff. We don't want to lose all the good stuff. Remember those bright spots I talked about in the beginning? We don't want to lose any of that, right?
I know, but I'm depressed now.
Should I take you back to the bright stuff? So I should have started with all this and then given you the bright stuff. So yeah, let's not forget that there's flexibility. There is good, caring, kind people that care about people's home life as well as their work-life balance and all of those things. So, this really took a deep dive, look at a lot of those things, but you're going to find stuff in everything, right? There's always stuff you can improve on. And so these are some major things that we want to work on and keep improving. But again, like I said, there's also the good stuff that's going on. And so we want to keep that. I do have hope. I do have belief we can get there, with a lot of good development and planning and then implementation of things. And that new manager position, I think, is just vital in this.
Yeah, that's
so
really good.
Yeah. Any questions or
questions, comments? Anything you want to add, Ms. Rudy?
I would just say that the safety issue of it is something that really bothers me. And, I don't know if there's a way to collaborate with the local PD for some of that staff that's going out to check in and out even, just so there's accountability. And the vehicles do bother me too, because I think at the county level, one accident is going to cost the county a lot more money than one vehicle.
I do want to say that they do partner really well with law enforcement. And so if they have knowledge of something or if there's, things in the report that would be, this is a safety issue, they do go out with law enforcement. And we have excellent law enforcement that do that.
City and the sheriff's
right,
department,
both,
all right?
Both, yes. So
Okay.
I failed to mention that. Both, they are rock stars in that. But that doesn't mean that, after kind of the initial piece and that with follow-up, they can be out in the homes without law enforcement because like it's been safe the last 3 times, right? So there's nothing. And then all of a sudden somebody used right before and then it escalated and you didn't expect that, right? So, there is just those things that are our world of child protection. I don't know that anyone, is doing this work without a death threat or assaults or those kind. I've had them, and it's not to minimize them. They are there, and I think we really need to do a good job of providing the best safety plan for them that we can. And so I want to make sure we're doing that. Yep.
Yeah, and I share your concerns for the safety issues, particularly checking in late at night, making sure that workers are home. That's scary. Well, I will just say that with your indulgence, meet with you and with Becky, come up with some plans for ways in which this board can assist with some of these issues, because employee retention and employee well-being I think are critical things that the county board needs to be thinking about. So work out some ways in which we can contribute. And I have already made a note to talk to Ann Vogel at facilities about the vehicles, and we can follow up with that. Any other comments? from
Facilities
members?
do a great job with us. It's just that they don't have.
There's-
yeah,
there's not
yeah,
enough.
Yeah,
Yeah.
just nothing against them. Yeah.
Yeah, Supervisor Steen.
Since we've been in this era of tightening our belts, we've been tightening our belts ever since I got on the board the second time. And so I know, and I've been on the Human Service Committee for the whole time, and I know for a fact that we're not in a position that we were in when I first started, when you had staff available to train people to take over for somebody in case they got sick or whatever happened. And we've lost that ability, so therefore everything almost becomes a crisis, you know?
I agree.
And I have some thoughts, I don't know, and I'd be happy to participate.
Absolutely.
Like for instance, I don't even know if you could have what you call a facilitator to kind of help get these cases to fruition, so to speak. And that might be a person that's well-versed in everything and can they could, what I'm trying to say here. I'm not saying it too eloquently, but, I don't even know if that's a possibility, but, and we did this with the best intentions of trying to save money. But in doing that, we lost the ability to train people to fill in. And now we don't have that ability because everything is a major crisis. So I'll certainly try whatever I can,
Absolutely.
but in the end, it's and that's the sad part about being in. If you don't have enough money, you either got to raise money or you got to probably limit your services. Well, that's it,
Yeah. It's hard to limit services in a mandatory program.
Well,
We have a
It's
liability
not
if
possible.
something
Exactly.
happens, we
Yeah.
have a higher cost. And I just want to make sure I also say that the staff in this unit work hard. They're, amazing staff that do hard things every day. And so, the things that we're seeing as symptoms, it's not the staff, it's symptoms of different things. And that's really what I was trying to get at is, what are the roots of that? So.
And I think
Yeah.
also, Polly's been in special ed her whole, special needs kids their whole life. And I worked 22 years in special needs and you got to do what you got to do to make the thing work. And so that's where you're at. And tough nut to crack. Thank you.
Thank you.
Yeah, and our compliments to you and to Becky for taking this on and making it something that we together can work at. I mean, given the kind of work that this unit and the whole Department of Human Services does, it's amazing that it functions as well as it does, and that's down to you. But we've got some issues that we need to think about.
For sure.
Thank you for sharing this. Thank
You're
you very
welcome.
much.
You're welcome.
Thanks to your staff.
Yeah, yeah. All right, we have our October vouchers in the amount of $584,023.62. I need a motion to note review. I am going to give it to Mr. Lamb. Moves. Supervisor Steen seconds. Any additional discussion on the vouchers? This is, our monthly checkbook. All right, all in favor of noting the vouchers for October, signify by saying aye.
Aye.
Any opposed? All right, vouchers are noted for October. And our next meeting is not until the end of December, almost the new year. So happy Thanksgiving, happy Christmas, yes, Supervisor Steen.
Thank you for all the happiness. I just want to point out that I was in special ed at a older age, and it shouldn't be special ed, it's special needs, I guess you could say. But Polly will attest to this, that one of the big problems of that is burnout. I was there 22 years as a special ed and as a special needs aide, and I think I had 5 or 6 teachers in that time. Is that about correct, Polly? Yeah, and I would say that what you were talking about today with the people that are dealing with emotionally draining, heart-wrenching situations that, and you can't, I mean, not many people can just blow it off and go home. I mean, it gets you. And so I appreciate the efforts of the people are putting in, thank you.
Yeah, and pass that on. All right, if there's nothing else, without objection, we are adjourned, and do happy holidays, happy Thanksgiving, happy Christmas. Safe hunt.